Today, I will be telling you something about Duchenne muscular dystrophy. Duchenne muscular dystrophy is an inherited genetic disorder caused by a mutation in the DMD gene where there is progressive weakness of the muscles of the skeleton and the heart. Usually it affects boys, but rarely girls with the mutation can also have symptoms, although mild. The mother notices her child to fall frequently while walking and running and complaining of tiredness and weakness in the legs. Usually the onset is between 2 to 5 years. Later on, there is difficulty in getting up from the floor, difficulty in climbing stairs, repeated respiratory tract infections, hypertrophy of the calf muscles, toe walking, waddling gait, etc. Usually between 12 to 15 years, the child loses independent walking capability and becomes wheelchair bound. The life expectancy is up to about 20 years and death is usually due to cardiac failure. There is really no complete therapy for this Duchenne muscular dystrophy. Only supportive therapy in the form of physiotherapy, steroid therapy to delay cardiomyopathy, and early treatment of respiratory tract infections. This is inherited as an X-linked recessive disorder, meaning the mother carries the mutation in her DMD gene. There is 50% chance of her transmitting this mutation to each of her pregnancies, and if it's a boy child with the mutation, he will be affected. If it's a girl child with the mutation, she will be a carrier like the mother. This disorder requires genetic diagnosis by a clinical geneticist, both for confirmation as well as for preconceptional counseling. That is, if the couple with a previous boy with DMD plans a pregnancy, they should have the counseling and the diagnosis for the exact mutation being carried by the mother. This is Dr. Saswati Mukhopadhyay of Apollo Genomics, Kolkata. My message to you is genetic disorders, it can be only prevented, not treated, so a diagnosis becomes very necessary. Thank you.